In March of 1995, my wife developed a severe pneumonia. She labored to breathe as one lobe of her lungs became completely filled with an infection and closed off. The physician caring for her lung was very concerned it might not heal and could possibly even require surgery and removal. We consulted an infectious disease specialist, and he placed Liz on intravenous antibiotics, steroids, and a nebulizer treatment. Fortunately, within 2 weeks, the pneumonia cleared. Her cough, however, persisted, and she continued on heavy medication for months. Of greater concern was her fatigue, which was now worse than ever. Liz was out of bed only about 2 hours a day. Her asthma and allergies were raging, and only with luck could she make the walk to the barn to see her horses. Liz was so sick the children took turns staying home from school to care for her. Constantly in bed, she felt too weak even to watch TV or read. This went on month after month after month. Although I maintained my professional exterior, on the inside I was growing desperate. I visited several times with the pulmonologist and the infectious disease specialist. They assured me that with Liz's diagnosis, they were doing everything possible. When I asked how long it would take for her to recover, the answer was 6 to 9 months, or maybe never. About this time, a friend of the family shared with Liz that her husband had also had a pneumonia and had experienced significant fatigue during the recovery. He took some nutritional supplements, and they had helped him regain his strength. Liz and her friend were aware of my negative attitude toward vitamin supplements, so Liz knew she would need my blessing before trying them. When she asked, even I was surprised at my response. Honey, you can try anything you want. We doctors certainly are not doing you any good.
So, can you describe for our viewers what it's like to only be able to be out of bed for a couple hours in any given day?
Well, just think about that. You know, if you could only be up a couple hours a day, you're going to just do the basic necessities. Also, it would be staying in the house most of the time too. But you know, brush your teeth, try to comb your hair, you try to maybe take a shower, and then you would have to rest.
So those things actually exhausted you?
Absolutely.
Day-to-day.
I could walk out to the kitchen to have a bowl of oatmeal and be completely wiped out after that meal and have to go back and lay down.
And how did that affect you emotionally to only be able to function on that very minimal level, like with your relationships and your friendships?
Well, it's a very difficult time. It's a very dark place. It's even kind of a lonely time. It's a desperate time. It's you're struggling. It's not where you want to be, but you're trying everything that you know to try. I mean, you're married to a physician, and you've got 4 other doctors that are there for you, and usually a lot of times this happens, but I was on a lot of medication. And one of the other things about people with fibromyalgia, they're very sensitive in a lot of cases. They can be environmentally sensitive.
Which you are.
Absolutely, very much so, environmentally sensitive. So the drugs are very difficult. There's something that, there's a lot of side effects to them. And to some degree, when you start getting a lot of mixes like that, it's toxic. I became really, really puffy, had a lot of fluid retention. And I think it affected my energy and everything, but yet that's all we knew at the time. That's all we knew what to do, so we were doing it.
So can you share with us some of your most vivid memories from the months surrounding your pneumonia?
I had strict instructions, and I had to agree with the doctor that I would not get out of bed except to go to the bathroom. And they were just worried I wouldn't rest enough because it was really, really serious. So that's the most vivid thing that I remembered, was just the urgency of it. They wanted to hospitalize me for 2 weeks in the hospital. They were worried that I'd caught something on an airplane like Legionnaire's disease because I was so sick. And so here I am, a person who struggled for years and just barely making it. So when I got this pneumonia, it just completely put me on tilt, where I was just totally and completely disabled.
What was it like to ask your physician husband, who had said numerous times in the past that vitamins just make expensive urine? What was it like to ask him if you could start taking nutritional supplements?
We had a gal that we took care of that was going through a difficult time, and she had a foster mother, And of course, everyone, my friends were all worried about me. They would come and visit and see me. And so she talked to Pam, who was her foster mother, and she'd had an experience with the supplements with her husband who'd had pneumonia. And I just am so thankful that she had the courage to call a doctor's wife and bring up the idea that there's a possibility that these vitamin supplements could make a difference for me, because I think that had to take not only a lot of courage but a lot of love to just step out there, because it's intimidating, you know, to call a physician's wife and say, hey, I might have the answer here for you.
Yeah.
But I really believe that God moved her to do that. And at that point, we were very desperate. We really did not have a lot of options. And fortunately, when she brought the supplements over, she brought over information about them. And as soon as I saw they were developed by an immunologist, microbiologist, and they were scientifically based, I was really excited, because one thing I knew for sure from all the years that I'd struggled is that my immune system was not up to par. Because I could not be around someone with a cold or someone with the flu, because I always got it, and I always was sick 3 or 4 times longer than a normal person. So I knew I had a compromised immune system. So I showed that information to my husband, and of course his initial response when I even asked if she could bring it over said, yeah, you can try anything, honey. I don't have any other answers. So it was kind of a shot in the dark in the beginning, but fortunately I figured, well, what do I have to lose? You know, we've tried everything else, we have no other answers, and maybe this is part of the answer. So
did you think that after all of the doctors that you'd seen and the prognosis that you'd been given, did you think that something like taking vitamins could actually help you when medically they weren't able to help you with all of the newest treatments and things?
You know,
like that?
I never, of course, had any idea that they would give me so much support and help me as much as they did. But I was thinking, even if they helped a little bit,
That's true.
a little bit, I'll take any help I can get, because I was in such a bad place. So because of she was kind and considerate, and then she gave us good information, we were willing to try, and that was just the first step in the right direction for us.
Can you take me through the first couple weeks that you were taking supplements and how your body responded to them?
Okay, yes, I'd be happy to. For me, the first thing that happened the very first week is I began to detoxify. And I didn't know at the time what was happening. And for me, personally, as I said, I had a lot of fluid retention. And at one point, I was having to go to the bathroom every 20 or 30 minutes. And that was pretty impressive for me. And really, it only took a couple weeks. And I just started getting up more, and I had more energy, and I can totally remember the day when I said to Ray, I'd really like to go on a drive in the car. Would you take me out? And of course he was really excited, because I had not been to a place like that for a long time. And I remember us driving around, and and I was feeling better. So later, of course, we found out that antioxidants can, especially when you've been on a lot of drugs, you can have some detoxification. And obviously my body really needed that. So that's the first thing that I realized. The other thing I realized is that I hadn't had any dreams for probably 10 years. Well, now I understand that when you go into REM sleep, which is your deep sleep, which is where your body heals and recovers at night, that's when you dream. I began to having dreams again. So now I know that it's minerals. Minerals help the muscles relax and help you to go into a deeper rest and a deeper sleep. And without that sleep, your body really can't recover. So this is part of the fibromyalgia, chronic fatigue syndrome, is a lack of sleep, and then your body doesn't get rejuvenated like it needs to.
And what was Dad's response to your rapid improvement?
Well, when he saw what happened to me, it was amazing to him. And of course, he had a very full and vibrant practice. So, and he did have fibromyalgia patients in his practice. So he decided to do his own study. He decided to invite 5 of his patients that were having the hardest time, probably his worst patients with that particular disease. And he just said, I don't even know if this will help you, but it's worth a try. And what happened was all those people had results with it, and they felt a lot better. And we were getting phone calls here at the house. They were crying, I've got my life back. I've been up on the roof helping my husband roof the roof. I just can't believe it, and those kind of calls. So after that, then I think he felt like he needed to be able to defend this scientifically.
Okay.
And he spent hours in the evenings till midnight at night doing research on the different studies that have been done regarding nutritional supplementation. And to his amazement, there's been thousands of studies done. And that's why he wrote his book, What Your Doctor Doesn't Know About Nutritional Medicine. He said, Liz, I was never taught any of this in medical school. They just taught me about pharmaceutical drugs and the effect on the body. Never were we told that we were told that if you eat right, that you don't need to take nutritional supplements. But no one ever told us about oxidative stress, free radicals, and what supplementation can do to support the immune system in the body.
A lot about nutritional supplements, but I know that there's a lot of other things that you have done to help you improve your fibromyalgia over the years. What are some of the other pieces to the puzzle that you found?
Well, that was just the beginning. We have found other things, like diet is really critical for the person with fibromyalgia. They have a tendency to eat sugar and drink coffee because they're so low in energy. And we know that that has a negative effect on the body. So that would be a part of it. We also like to guide them in their exercise programs. In the beginning, we always say, don't exercise 2 days in a row. And you have to be very, very careful because that can put you on tilt. And now we're getting new information about when you sleep at night, the amount of air that you're getting. And we're finding out that, we know that people with fibromyalgia have sleep disorders, but now we're finding that we're wondering if some people have fibromyalgia because they aren't getting enough air. And one of the newest things that we've been working on the last few months is an appliance that opens up your airways. So some of these people that don't sleep or go into REM sleep, they can actually be built in such a way that their tongue falls back and they're not getting as much oxygen at night. And I've been fitted with one of those appliances probably about 8 or 10 weeks ago, and I can tell now I'm even doing better than I was before. And I'm sleeping all night long without waking up, and waking up without body pain, which is some of the things. I'm very active and I do a lot of physical work, and so I can get kind of stiff and have body pain, and I'm noticing I'm starting to wake up about an hour and a half earlier in the mornings, and I've only been using that for about 8 weeks. So we're even finding more information. So there's a variety of things and struggles that you have when you have these weaknesses in your body, and we have found different things that make a difference, and we would love to share those and give people guidelines so that they can have quicker success.
In part 3, we're actually going to be inviting Dr. Strand to join us, as we want to hear from him how this very personal story challenged him to reconsider the way that he had been practicing medicine for more than 30 years, and eventually led to him changing his focus over to nutritional and preventative medicine. If you're interested in learning more about Dr. Ray Strand and what he does and his unique approach to preventative and nutritional medicine, please be sure to check out his online medical practice at www.raystrand.com.